In my previous video, I promised you to explain what is the meaning of EAU and to give you a joint station. What does that mean? I'll explain everything. Just hold on. So, EAU, Emergency Assessment Unit, it is basically this massive ward that is big enough to take all the patients that are just admitted under medical team, or they're not really in need to go to the ward. They're probably going to be admitted just for 1 or 2 days and then go. So the patient went into the hospital straight through A&E. A&E did their assessment. The patient does not need any surgical intervention. The patient is chest infection and just needs some antibiotic IV, for example. They called the medical team, the medics, we say. So the medics say, okay, we'll accept the referral. This patient now is going to be transferred to Emergency Assessment Unit, EAU. In EAU, basically, you'll have to clerk the patient all over again. You'll have to admit the patient in the hospital again, even though he was just admitted by A&E, but you have to redo it. You go and you talk to the patient, you get the history that you want, you get the management. Whatever they manage, you might have to change it. Don't forget, A&E, they're not responsible for continuity of care. They get the hot case, they do what they do, they get the diagnosis, and then they just transfer the patient to someone else. So you manage, you do whatever you want. Now, here's when it gets tricky. What if you get the patient that needs two teams? For example, a patient who overdosed on something. Let's say paracetamol because it's the most common. A patient who overdosed on paracetamol, hypothetically speaking. What are you going to do? You're an FY2 who works in EAU, concentrate, or who works in medics. They didn't say who works in psychiatry. If you work in EAU or in medics, your job is basically reverse of paracetamol overdose. You want to make sure that you've given the antidote. You want to make sure that you've done the treatment properly, that you've done the investigation needed, that you're checking on the liver. They want to know that you can medically handle a patient who overdosed on paracetamol. Now, they said you're an FY2 working in psychiatry, and you got a patient who got overdosed on paracetamol. What are you going to do? It's not your job to manage. All you have to know, all you have to say is that I will liaise with the medics to check that you are on the right treatment. But here your job is assess why the patient overdosed. Is there risk of doing it again? This is a counseling station. You want to do more, you want to basically concentrate on the mental health.